So a very good evening everyone, this is Dr. Shubham. Welcome back to my channel, and today in this session I'm going to discuss about the bulimia nervosa. In the last session, as you know, that we have talked about the anorexia nervosa. So we'll try to figure out how this bulimia nervosa is a bit different from the anorexia nervosa. So usually the question comes from these two topics very frequently, and generally they ask us about the main difference that what is anorexia nervosa or the bulimia nervosa, right? So if you talk about the bulimia nervosa, guys, here this is an eating disorder again. So let me just write over here very fast. So again, this is an eating disorder only, but here what is the problem is that in this case there are the recurrent episodes of binge eating, which is followed by the compensatory behavior. What do I mean by the compensatory behavior? I mean that if the person will be eating so much, right, first of all they will be satisfying their tummy, and after that they will be having the compensatory mechanism, means that they will be going to the washroom and they will try to vomit it out. They will try to vomit out the content which they eat or the food which they ate. So they will be having that guilty mechanism inside, that now they have eaten so much amount of food, so in order to lose the weight I need to just vomit out the content, right? Or they might use some kind of laxatives also, so that they can flush out the food from their body, right? So that compensatory mechanism is there. In comparison to this bulimia nervosa, when I was talking about the anorexia nervosa, I told you that there the patient behavior was food restricting behavior was there. In the anorexia nervosa, the patient is not ready to eat the food at all, because they will be thinking that they might gain the weight, right? Which is actually not the case, right? So there I told you in the anorexia nervosa the BMI was on the lower side, and here in the bulimia nervosa I will be saying that BMI will be normal in this case. So this is also a very important feature which you can compare with anorexia nervosa. So anorexia nervosa was having the BMI on the lower side, which means less than 18.5, and here the BMI will be normal, means between 18 to 25, obviously, right? So this is the eating disorder, guys, and eating disorder which will be actually marked by the recurrent episodes of binge eating, right? Marked by recurrent, right? So again and again the patient will be eating recurrent episodes of binge eating, followed by compensatory mechanism. So I already explained you what are those compensatory mechanism. Compensatory mechanism simply means they will try to flush out the content from their body, right? Mechanisms, right? For example, by the uses of it might be the use of laxative, it might be the use of their finger. They will use their fingers and they will put them in their mouth, and they will try to vomit out the content. That is the thing. And because of that, repeated insertion of fingers into the oral cavity, that will actually initiate the gag reflex, right? And they will try to vomit out the content of their food. So in order to do that reflex, in order to put the fingers into the mouth, they might have injuries in the knuckles, right? They might have injuries in the knuckles, as you can see in this picture over here, right? You might see these kind of injuries to the knuckles. Why? Because when they are putting their finger in the mouth in order to initiate the gag reflex and in order to initiate the vomiting, here they might get these kind of marks, and actually these marks are actually called as the Russell sign. Yeah, so this is the Russell sign, right? This is the Russell sign. So this Russell sign is very important. This can be seen in the bulimia nervosa. So Russell sign will be seen in the bulimia nervosa. Very important thing here. In this photo, what you can see is in this picture that the person will be doing the binge eating, right? And then self-induced vomiting, and due to that self-induced vomiting, putting the fingers into the mouth, they might get this particular sign, which is the Russell sign I told you. Again they will be doing the binge eating, again they will be doing the vomiting. So this is a vicious cycle which they will be having usually in their lifestyle, right? So that's what I'm talking about in the bulimia nervosa. They will be eating the food again and again and vomiting it out again and again, right? So that cycle will be seen in this kind of patient. The patient will be feeling that they are not having the control on themselves, right? So they will be feeling that there is loss of control on themselves. They will be feeling that there is a loss of control on them. So they will not be able to control themselves to eat excessively actually, and then they will be doing the vomiting, obviously, right? Those are the compensatory mechanisms. Okay, now weight usually, okay, if you talk about this particular thing, weight usually in these cases will be remaining normal only. During the physical examination, the weight of this patient will be on the normal side, so that's why BMI will be on the normal side again as compared to the anorexia nervosa, right? And here you can see some of the signs over here. For example, you might see that person is having the parotid gland enlargement, right? Parotid gland might be enlarged over here. Why? Because probably because of these self attempts of doing the vomiting and all, they might be get irritated. Then some of the dental cavities might be there, right? That can also be the case, which can be seen over there in these cases. About Russell sign, I already told you that what is Russell sign and why these patients might be having the Russell sign, right? That's Russell sign positive, and it has been asked also multiple times, right? So this is very important. Then if you will do, because I said that there will be the self-induced vomiting, right? So you might see the electrolyte imbalances in these cases, right? Due to that, you might see that there could be the electrolyte imbalance, right? Obviously, electrolyte imbalance. Which electrolyte imbalance? The patient might be losing the potassium ions in this case, because obviously the person is doing the vomiting, so they will be vomiting out this potassium over there with that. So electrolyte imbalance might be seen over there. Mainly the potassium ions might be seen on the lower side in this case, right? So hypokalemia. So acid base imbalance can be there, as we know with the medicine, that with the vomiting, the person is always having the chance of getting the metabolic alkalosis, right? Why? Because they are actually losing out the acid, because gastric content, if they are losing, it means they are losing the acid at the same time. So the patient might be having the metabolic alkalosis. Which kind of metabolic alkalosis? It will be the hypokalemic, because obviously electrolyte imbalance, potassium they will be losing actually potassium. So hypokalemic metabolic alkalosis might be seen in this patient, right? Yeah. Then what will happen? What about the differential diagnosis? Yeah, so what about the differential diagnosis in this case? So yeah, as you know already, anorexia nervosa is a very confusing term over here. Like these two can be confused very easily. So anorexia nervosa is the important differential diagnosis, because there also similar kind of pattern will be seen, but yes, as I already told you, compensatory mechanism will be seen in the bulimia nervosa, not in the anorexia nervosa, right? Then if you talk about what will happen to the treatment side, right? So about treatment is also very simple. Yeah, you need to actually figure out what you can do about the electrolyte imbalance. So you need to replete the potassium ions over here. So electrolyte imbalance, you need to actually correct it down. So I'm just writing it over here. Correct the electrolyte imbalance in this case, right? Then next thing is cognitive behavior, right? So cognitive behavior management is there. So cognitive behavioral therapy, right, that should be done because this is a psychiatric problem. So cognitive behavioral therapy should be done in these cases for these particular patients. Then if they are not responding, right, let's say if they are not responding, then you might take the help of SSRI over here, right? Then you might take the help of SSRI, selective serotonin reuptake inhibitor, and for example you might take the help of fluoxetine, right? You might take the help of fluoxetine drug, right? So this is about the management part over here. What can be the complications in such cases? Obviously complications are very, very simple to think over here. As I talked about the electrolyte imbalance in this case, so there might be the hypokalemia, there might be the metabolic alkalosis. So same things over here. Okay, so hypokalemia and electrolyte imbalances might be seen in these kind of cases, and like metabolic alkalosis, as I told you already, right? I have just mentioned about them once again. Okay, then what about the prognosis? Yeah, prognosis is good for the 50% patients, right? They might be recovered very well after the treatment. Some of the patient might be having the partial response, and some of the patient might not respond as well. Like 10 to 15% of patients might not respond as well, and they might be having the chronic symptoms. So this was just a short discussion about the bulimia nervosa. I hope I was able to deliver the message. So if you enjoyed the session, please hit the like button, do subscribe my channel and share it with your friends. Thank you so much for sparing your time in this particular session. Thank you so much. I will see you in the next one. Thank you.